we all know the president defending Obamacare today, but even he's admitting that he's frustrated over the glitches plaguing the sign-up website. Still, he says that the insurance itself is helping people, and it still remains a good deal.
The fact is, the product of the Affordable Care Act for people without health insurance is quality health insurance that's affordable. And that product is working. It's really good. And it turns out there's a massive demand for it.
So our panel of doctors is going to weigh in now. Dr. Bob Lahita is the chairman of medicine and vice president at Newark Beth Israel Hospital. Dr. Devi, associate professor at the NYU School of Medicine, and Dr. Nina Radcliff is in private practice. I really wanted to assemble a group of everyday physicians, and I mean that in a very high-class way, to get your points of view about what you think about Obamacare. So, Dr. Bob, let me start with you. Do you believe that this will be a good thing or a bad thing for you?
Most physicians feel this is going to be a bad thing for them. For me, as chairman of medicine, I take all insurances. I see Medicaid, I see Medicare patients. However, for my colleagues in private practice, it is sort of a disaster, simply because we're really uncertain about the patient exchanges. There are going to be approximately 20 million more Medicaid patients given to us.
Right.
We don't have the manpower. We have a doctor shortage. Primary care physicians are very difficult to find, and they're not going to be there for these patients.
Mm-hmm. So speaking of private practice, I'm going to turn to Dr. Nina, right? Because you're in private practice.
Right.
So do you agree with that?
I agree. No one in their right mind would enter into a contract or agreement without knowing the terms and conditions. It's like getting married to somebody without ever meeting them, their parents, or knowing their likes and dislikes. It's absurd. It's like playing Russian roulette.
Mm-hmm. Dr. Devi, do you agree or disagree?
I agree. I actually think these problems with the website are a sign of a larger problem. You know, the system is getting overloaded because so many people are trying to sign up for healthcare. The same thing could happen with the medical system. So many people are trying to get in to see the doctor even today, and it could be worse when we have so many.
Isn't the biggest issue for physicians is the reimbursement? Because you don't know yet how much you're going to be reimbursed, correct?
Correct.
And can you make it as a physician? I mean, back in the olden days, being a doctor, that was considered just an incredibly high-income job.
Absolutely.
And now, what does this do when you don't know the financial numbers in the bottom line?
And the numbers are getting lower and lower. We really have no idea as to what we're going to get paid, particularly since there are now independent panels to tell us what we should be paid. Insurance companies are heavily linked with the new Medicaid rollout. It's going to be very, very difficult.
Let's talk about Vice President Dick Cheney, because he said in a recent interview in his new book as well, that when he had the pacemaker put in, he was actually worried that a terrorist could hack into it. And so he wanted the Wi-Fi component of it taken out and asked his physician to do that. We saw this on the show Homeland. Could this really happen?
So not everything that happens on television is real. Star Trek, they used to beam Scotty up. It won't happen necessarily. There are no reported cases of it at this time, so I do not want people to be concerned or not get pacemakers placed that could be life-saving.
Mm-hmm. Dr. Bob?
I agree with that. It's a stretch to think that a terrorist could really inactivate specifically the vice president's pacemaker. However, theoretically, it could happen, and his doctor is aware of that as well.
Let's listen to the vice president.
I was aware of the danger, if you will, that existed, but I found it credible because I knew from the experience we'd had and the necessity for adjusting my own device that it was an accurate portrayal of what was possible.
Dr. Devi, I mean, he's the Vice President of the United States, second in command.
Well, something like this is not possible today, but I do think just the way technology is, I mean, it may be something that's possible years down the road.
All right. Well, the doctors, the real doctors of the real world, with real talk here today on The Real Story. Appreciate your time today. Thanks so much.
Thank you.
Well, a dad is tied up. 3 armed men threatened to shoot and kill his young daughter. Ahead, the amazing story of how he used YouTube and this rap album cover to track down his own attackers. And researchers say they may be on the verge of a cure for baldness. I should have asked the doctors about this one. Details coming up.